So going back to depression, I want to focus in on this a little bit because I'm concerned that we have a potential generation of a lot of not depressed kids, but some depressed kids because of all of the impact. What resources do we have? How would a parent come to you and say, I'm worried about Johnny and his mood, or what do they look out for? Yeah, I mean, it's easy to say, hey, he's very sad and he's just sitting in a corner, but what other hints and clues do we have?
Yeah, there's a very objective way that we do this.
Okay.
So starting the age of 10 or 11, at every visit, at every well visit, we do a questionnaire, a rating scale. We give Billy or Johnny a standardized tested questionnaire, 9 questions. We call it the PHQ-9. So based on the responses, Billy or Johnny would fill it out himself. Of course, mom is there, but the questions are so self-explanatory that he can fill it out himself, he or she. We've been talking about Billy and Johnny and forgetting Megan and Sophia.
I know.
So they would fill it out, and based on that, we know, we can tell from that questionnaire, we can ask some leading questions from there.
Right.
So at least once or twice a year, when 11-year-olds and above 12-year-olds, we do have that measuring tool that we would use. But outside of that, many parents call us in between that, I've noticed this and that, and we take it from there. We encourage a visit, whether it's through telehealth or directly in the office, and we would then use that measuring tool and then take the leading questions from there and actually find out what's going on. And that's the way we assess it. Initially it was, oh, how's Johnny feeling? Oh, he's fine, he's a little quiet. It was not in depth, but with this tool, we're actually able to go in depth and measure. So it's been tried out. If you're negative on all the questions, you're fine. If there's a positive, then it depends on the follow-up questions.
Right.
And that often leads us on to do this, or see this counselor, or let's do this, some sort of intervention to make the situation better.
And how far out do you go with this rating scale? Do you go beyond 16, or where's the cutoff?
So it's right through the adolescent years,
Okay.
and we see children up to age 21. We like to hold on to them a little longer. So yes, it's standardized for all of those ages.
Right. So the message here is obviously that we have to make sure we bring our kids of any age to their primary care provider, their pediatrician, so that they can do this screening. It's often where the adolescents and the 16, 17-year-olds, it's a very tricky age, and where they start getting a little bit more independence and a little bit more voice, and they may not get that screening that they really need, especially during this very serious time.